Hello, everyone. My name is Viveka Edwards, and I will be discussing my evidence based education innovation project that I will be implementing in Nursing 597. I have done a lot of work, a lot of background work on my project, and I'm very excited to present this idea. The topic of my project will be basically introducing nursing students to additional topics that includes the nursing experience, the culture of nursing, the problems, all of that may not purely be discussed in nursing classes. This basically came about when I was talking with one of my mentors, that is actually my preceptor. We were discussing different topics that she sees in her college as an educator. And one of the things that we kind of went, or basically a tangent that we went on, was thinking about, okay, well, reality shop. Um, a lot of nursing students, after getting their license and going into their first job, we see that a lot of them it may not be what they expected. It's kind of like a big shock as to, okay, this is what I'm doing. I really wasn't thinking this. I thought this. So we started to see that there were other students that were coming back to her, basically stating, yeah, that's not what I thought it would be, or I wish that this information was presented. Through that conversation, we saw that there was obviously a need. So I started brainstorming and actually talking to other faculty members as well as my preceptor about what can I do, what can we do to prepare these nursing students so that we can decrease reality shock, and kind of prepare them more for just the nursing profession. We saw that there was a need to present an opportunity to nursing students to discuss additional factors in nursing that purely is not related to education and skills. There was the introduction that needed to be had about cultures of today's nursing, the environment of students that they may work in, the politics. I mean, even thinking about the metrics that a lot of nurses, especially with me being an emergency department nurse, have to keep up with, as well as the emotional strain that these can have on nursing students when they get out. Reasons leave that new nurses may leave a profession within a 2 years time span was basically seen, or actually researched, when I looked at it in a journal article that was published in the American Journal of Nursing. It was basically entitled "Not Newly Licensed RNs Characteristics and Work Attitudes." And I remember reading that research and thinking, wow, it said that 13% of newly licensed RNs changed their whole principal job after 1 year of getting into their nursing profession. And about 37% reported they felt like they were just ready to just end nursing and get into something else. If you want to really think about the shortage that we always hear about in regards to nurses, you really think of, okay, 37% of people, if 37% of new nurses decide, hey, I do not want to be in this profession for whatever reason, we're losing a lot of nurses. And that is not a good thing when you're actually looking at a profession that's already in a shortage, and a profession that's solely needed, especially in today's society. With COVID-19 and everything else that's going on, having nurses that are happy, having nurses that want to stay is very imperative. So in regards to my project, the description of it is basically a virtual online class that will last about 1 hour. This will be presented on the Blackboard virtual platform at the college that I'm actually precepting that is currently using to give information, to deliver the information. This project will actually take place during boot camp, which is something that the educators put together after they saw that during COVID-19, a lot of nursing students were not able to get into certified nursing assistant classes, as well as they were missing a lot of things. So they decided to put together this boot camp, and I thought, great, this would be a great time for me to give the information to them. The participants of this project are juniors and seniors, nursing students at a local college here in Charlotte, North Carolina. The education level of each one, of course, they are juniors and seniors, but their actual experience level basically varies. You have some students that are already nursing assistants. You have some students that work into a hospital or clinical setting, and then you have some students that do not have any type of hospital, any type of clinical experience. They just know they want to become nurses. The topic, like I said, would be introducing them to additional topics that can include the nursing experience, the culture of it, the problems, and just basically having an open forum. The goal of my project is basically to prepare nursing students to so much as possible and decrease the reality shock and stress that they may have when entering the unknown. To help with the teaching, I decided to pick a constructivism theory as well as a narrative pedagogy, which will kind of help me to guide, teach, and kind of find a little structure in regards to my project. There would be moments in my project of formal discussion, and basically this is for exploratory learning and to basically provide more comfort in a comfortable setting for students. There will be questions at the end to basically clarify information or to gain more knowledge. There will also be a way for students to ask questions or make comments after the session, and this is basically to provide them with more support after the session, because again, this will be a 1-hour session. The intended outcome of my 1-hour orientation session is basically to increase the comfort and to provide new information to nursing students that they may not already know. I will be doing this by having a 9-item qualitative knowledge survey that will be given before the session. And the survey will ask questions about their comfort as well as their knowledge in regards to subjects. This could be their desired specialty, their knowledge that they may have in regards to common workload, and if this, when you're looking at patient ratio, also I'm looking at, or we'll be asking them about the knowledge of bullying in workplace, as well as knowledge of common work schedules, ethical decisions that they may have to make. These are just some items that I'll put up there. Of course, like I said, this would be a 9-item qualifying survey that I would be presenting to them. It would be ranked between 0 to 2. 0 being no knowledge or unsure of their comfort level. 1 would be some knowledge and some comfort regarding the subject. And 2 would be very knowledgeable and very comfortable about the subject. So my idea is that I will be giving them this pre-survey with those questions up there, with different subject matters, with 0 to 2 rankings that will be given before. And then after the information is presented, I will go back, give them the same survey, and see if there is an increase in knowledge. For example, if I see that there is a student that felt 0 comfort and had 0 knowledge regarding workplace bullying, and now they feel like they have some knowledge and some comfort level in regards to it, then I feel like that there is, some new information that was presented, and I can actually prepare them for what may or may not happen. Again, this is just an example, but this is just one thing that I would definitely be doing. To support all my information, I will be having or using or have used learning theories and research that are up to date and that basically can hone on everything about the knowledge, about the items that I'll ask the questions in regards to the students. In conclusion, I hope this information highlights the direction of my innovation project. I am very excited about conducting this project, and even more excited that I am very close to completing this degree. I hope you have enjoyed my presentation. I hope I gave you the information. If you have any other questions, feel free to please contact me. Thank you. Have a great day.